scan from one of our recent patients, and what it shows us is, as suspected, he had some disc degeneration in his lower back, which is where the area where he was getting some pain. And previously he'd been told he's got various misalignments, his hips are out of alignment and that sort of stuff, but I really suspected it was down to this stuff. And what we now decided to do is use some IDD therapy on him to traction out these discs, actually, but also to try and stabilise this area with some exercises, reduce the muscle spasms with dry needling, and actually focus the mobilisation and stretching on the higher areas of his spine which were too stiff, and putting pressure on his lower back. And I should also add, one of my recommendations for John was that he stopped having manipulation, at least on this area here, because really when he's having manipulation, clicks and crunches down here, whilst it may be giving him some short-term relief because there's a reflex relaxation in the muscles here, long-term what it was doing was just kind of making these ligaments, making these segments even more mobile, so actually perpetuating the situation for the long term. So really it was much more about giving him some exercises to do, as I said, the dry needling as well, but the exercises to try and help stabilise that, and then the exercises to mobilise this other area in his spine that was stiff. So really loosen up the stiff areas, tighten up the loose areas. And like I said, we've gone a little bit further now down that road in terms of trying to refer John for some injections to really help to try and to stiffen these ligaments down here even more.